Well, we take our children to the doctor when they are sick, but what about their mental health?
It's an essential part of their well-being. But why do we sometimes overlook it? Dr. Laura Saunders from the Institute of Living is here now with more. Yes, if our kids break their ankle, we always go straight to the doctor, right? But if they're crying and retreating to their room, then we sometimes don't know what to do.
Hello, friends, and happy Wednesday.
Happy Wednesday to you as well.
So, yes, you know, we do this segment, we talk about mental health, but sometimes it's good to come back to the basics. Like, why is mental health even important? A lot of time people assume that they're fine, right? Kids can't have mental health problems, but that is, in fact, not true. I mean, let's take an example. So a young boy is overweight and he gets teased, and then maybe he gets bullied. He withdraws socially, he becomes depressed, and he doesn't want to exercise, he doesn't want to socialize, and then that affects his physical health, right? So we need to remember that mental health and physical health are so closely connected. There's a tremendous amount of unmet need and health disparities in special populations, the LGBTQ population, ethnic minority populations, any individuals with learning disabilities. So it's really recognizing how the interplay between mental health and physical health is so critical.
This says an estimated 15 million of our nation's young people can be currently diagnosed with a mental health disorder. Is that right?
Yes, and I frequently like to throw out some of these statistics, right? Because what we need to realize is that it's not that uncommon. We're still working very hard on reducing stigma and discrimination around mental health issues. And if you feel like, oh my goodness, I think my child has a behavior problem, or my child's depressed, or my child's, very hyperactive and having difficulty in school, you think I'm alone and I can't talk about this. But I want people to know that you're not alone, that this is not as uncommon. I mean, the rate of depression in high school kids is about 1 in 10, right? That's 10%. Wow. So it's a lot more common. So not to be afraid to access mental health services for your child if they're struggling.
How do you know if it's just normal teenage anxiety versus you need help? Because teens are naturally a little anxious, right?
So the guideline that I use is, does it hinder their functioning? So, I mean, summer now, kids should be doing activities. Yes, do they sleep in a little bit? Are they a little bit more low energy? I'm trying not to use the word lazy. So, if they're low energy, but is it hindering their functioning? So they previously used to like to go to a lacrosse camp, and now they refuse to go. They used to like to do things, and now they refuse. So, when kids are in school, does it hinder their functioning? Does it hinder their ability to learn? Does it hinder their ability to do things with friends? Does it hinder their ability to function within a family? So does it hinder their functioning is the guideline. Everyone has a bad day. Sometimes even a bad couple of days. But when it hinders their functioning in one of the main spheres of their life, school, home, and social friends, then it's a concerning problem.
How do you go about obviously everybody would love to see you, but how do you go about getting a therapist and, getting those referrals? Where do you start?
A lot of times I encourage people to start with their pediatrician. Pediatricians have lists of mental health professionals that they work with. Some practices are even working on what we call integrated care. So there's a psychologist or licensed social worker in a practice so that you can make direct referrals to. School personnel, school psychologists, school social workers have connections with local mental health professionals. Sometimes ask a friend, right? That can be really, really relieving to say to your friend, my child's struggling, and then you realize that maybe their child was struggling too, and you get a referral from a friend. So there's ways to get referrals that are more kind of sourced as opposed to just looking up in your insurance and finding someone. So trying to get a more direct referral, but reach out for help if your child is struggling in any way.
Yeah, that's great advice. Somebody asked me last week in an email, what was the name of that doctor? I was like, Dr. Laura Saunders with the Institute of Living. And we're proud to have her on the show.
Are you taking new patients?
All right, thanks, Doc.
Take care. Have a good day. Stay safe.
You too.